The problem in healthcare is that there's a lot of fragmenting between systems, between healthcare systems, between the machines. And in order for your radiation oncologist, your surgeon, your oncologist to come together to come up with a plan, they have to kind of pull data from all different systems, from all different diagnostics and therapies. And that planning sometimes extends the time from which you get a cancer diagnosis to the point at which they can actually give you treatment, whether it's surgically, whether it's radiation, whatever it is. In order to get that treatment, it's delays the amount of time before you get that treatment. And that can be the difference in a patient's outcome. So, Ben, can you give us some real life examples maybe of how this technology has kind of implicated or implemented in the treatment of a patient with breast cancer or prostate cancer, and how, what kind of changes that they have in the outcomes of their cancers with this platform?
So right now we are implementing in a few sites. We've got 2 sites operational, one in Europe and one in Asia. We're setting up some sites in the US, but in a nutshell, being able to deliver that therapy on the same day instead of delivering the therapy 2, 3, or 4 weeks later means that we can stop the cancer in its tracks on the day that the treatment decision is made. Now, as you know, from a cancer perspective, cancer continues to grow. Some cancers are very aggressive. They will double in a matter of weeks in size. So if you're able to compress the time to actually reduce and stop cancer in its tracks almost as soon as you diagnose it, that is invariably going to impact the outcome for that patient. So right now we're going to study the impact in terms of clinical outcomes. We're at the stage where we've demonstrated the technical and the kind of logistic and efficiency outcomes of compressing that time. But what we want to do is show the impact of being able to treat sooner on clinical outcomes. And that's where we're confident we're going to see not just an improvement in outcomes. We may even, for some aggressive cancers, see a change in, of course, mortality as well. And that, of course, is game changing. That's where we want to go. We want to make sure that from a patient perspective, the technology is not a barrier to care, and that the technology in being able to be delivering that care more effectively can actually deliver the kind of outcomes that we expect.